Okay, thank you, Professor. It's my great pleasure to be here this afternoon. So I will try to present this as the outcome of 5 years projects in collaboration with Hokkaido University about ecological sanitation. And it's very good to present it just after Dr. Ito because some presentations, some specific element, mainly concerning urine diverting toilets, is already presented, so it will help me to present my work. So this content, we will start it by presenting very quickly what is urine, and after that, we will focus, as we're talking about sanitation, ecological sanitation. We will discuss more about urine valorization as fertilizer in agriculture. But of course, since it's at the beginning of waste, it's important also to focus on health risk and urine valorization. And after that, we will finish by 2 main types of urine treatment. Okay. Thank you. So what is urine? Of course, you already know, but urine is, I tried to pick up different definitions on the website. And what I just want to highlight is that at the beginning, everybody is agreed to see and to tell that urine is a waste. But for ours, engineering in sanitation, urine is yes a waste, but we want to make urine something else than waste. And for that, we have to treat it to be sure that utilization of urine will be safe, okay? So if you take the more simple definition, what is urine? It's a yellowish liquid waste that is released from the body when you urinate. So very simple definition. And the more completed one, it's a pale yellow, slightly acidic fluid excreted by the kidney. So you have some illustration here containing waste still, okay? Product removed from the blood, and it's stored in the urinary bladder, as you can see in the figures, and discharged through the urethra. Okay, so this is a slight definition of urine. But what is more interesting for us as sanitation engineer is the composition of urine. As well illustrated by Dr. Ito, is mainly 95% of water. But it's the remaining 5%, which is very interesting for us. And in this remaining 5%, you have urea, 2% containing in urine. And the degradation of urea, we will see it later, is very interesting for us because it's the reservoir of important nitrogen. And we will see why it's so interesting for us. And here also, it's important to know that a human healthy person can excrete between 1 to 1.5 liter every 24 hours, okay, of urine. So it's, of course, a very important quantity of waste which should be managed carefully because this can be a resource, but it can be also a pollution if it's not removed from the environment, especially in water bodies, because it can create, of course, as you know, eutrophisation because of important quantity of nitrogen. So let's talk about what is really interesting for us. It is valorization of this urine, mainly in agriculture as fertilizer, okay? So what we want to do when we really focus is to move from waste to fertilizer. So in a plant, as you know, this is really a quick recall, plants to grow, and especially in agriculture, to have a very good yields, production, we need 3 families of nutrients. Microelements, meaning that different nutrients the plant need in relatively high quantity which is nitrogen, phosphorus, and potassium. And at intermediate quantity, we have secondary elements, calcium, magnesium, and sulfur, and microelements, meaning that plant need it at very small quantity, but is necessary for his growth. We have some, especially here, manganese, copper, and etc. I just highlight some here. Why? Because actually, in urine, we can find them. And we will use them as valuable nutrients for plants. And of course here, the most interesting is urea, as I previously said, because degradation of urea gives nitrogen, and also you have here some part of this degradation already in ammonia form, which will complete its degradation and lead to nitrogen also. Nitrogen is the available form of nitrate, which plant can uptake directly. And also we have secondary element in urine. People used to forget it, but it's very important. We have calcium and magnesium, useful also for plants. So before talking about health risk, in the context of this project, we make studies on the fertilizer value of this urine on vegetables. Here, the test was on okra. Okra is a very famous vegetable, both in Africa and in Japan also. And these studies clearly show one important thing. It's that even if urine have a very high fertilizer value, it's important to make this fertilization very suitable. Meaning that here you have several treatments. And as you can see, using only urine is not a good thing for agronomic values. It gives the baddest result, okay? Because using urine in high quantity could be could give very, very low productivity. The best treatment here is a combination of urine and 75% with 25% of compost. This gives the best treatment, even better than the conventional treatment with the commercial fertilizer. So yes, urine is a valuable nutrient, but it should be used very suitable and in the best and the very optimal quantity to reach very good productivity. So what is, of course, when we also see in terms of production of the fruits, yes, it's the same as previously. The best production is for the treatment combining compost and urine, and the worst treatment is when you use only urine. So now, let's talk about health risk. So here, healthy person, in the bladder of healthy person, actually, urine do not contain pathogens, okay? So, how urine could be contaminated by pathogens? Firstly, indirect contamination. You can have here cross-contamination with feces. As you know, feces are highly contaminated by different sorts of pathogens. We will see the different type of pathogens. We can also have bad condition of keeping the collected urine, which can increase the indirect contamination. In the other end also, when people are ill, they can excrete directly some pathogens in the urine, which is also one pathway of contamination. So, which type of pathogens mainly contaminate human urine? Potentially all pathogenic bacteria, parasites, and viruses contained in the fecal matter are likely to directly or indirectly contaminate urine, okay? So what is the different kind of pathogens? Concerning bacteria, you have here several types. The most frequent one, mainly E. coli, the pathogens one, coming from infected person which have diarrhea, feces and urine as a reservoir of typhoid carrier of patients for salmonella. You have also two types of salmonella, and Shigella Also, the reservoir is feces, carrier of an infected person, Campylobacter. Also here, the reservoir could be human. And cholera. Also, the main reservoir is feces. So concerning parasites, meaning cast and eggs of elements and protozoa, it's actually the same reservoirs, meaning infected person, humans, infected person for the main common parasites disease, which is Giardia, Cryptosporidium, and Entamoeba histolica. And to finish, viruses, also the same reservoirs, human feces and feces from infested person. You have hepatitis A and some rotavirus also. Okay, here also is interesting. For direct contamination, this is a frequency and distribution pattern of urinary tract infection, meaning that when people is ill, and he will excrete directly some pathogens in the urine. And as you can see here, the most important pathogen and direct contamination of urine comes from E. coli, pathogenic form of E. coli. So this previous slide clearly shows that urine must be treated before utilization in agriculture. So this is my own reflection after 5 years of project. What is the main criteria to make urine treatment very easy and efficient in developing countries? First criteria is simple to implement by farmers themselves. The second one is it should be cheap and even free, because we are in the condition, as previously illustrated by former presenters, in rural areas especially, people are poor, and actually the activities, agricultural activities, is subsistence agriculture, with the closely dependent to rainfall, but also usually it's free to fertilizer addition, meaning chemical fertilizer, because actually this fertilizer is too expensive for those people, so they just count on the natural nutrient content in soil, and especially in sub-Saharan Africa and in Burkina Faso, naturally the soil are poor in nutrients. So the productivity of the soil is very low, and to cope with this food production challenges and food security challenges, it's now more and more compulsory to add additional fertilizer in the soil. So this is a big challenge, and urine addition in the subsistence agriculture could really complete the lake of fertilizer in our soil. But this source of fertilizer should be at least very, very cheap, okay? And also the third criteria is no electricity dependent, because similarly, it's some areas with electricity do not exist. So if the treatment process is dependent on electricity, it will be difficult to implement it in this condition. And to finish, it should be, of course, efficient in pathogen inactivation. So the first type of treatment is actually the most used one worldwide. It's just urine storage. Here you can see it's a project implemented also in Burkina Faso. It's implemented pretty everywhere now in developing country, and we used to call it EcoSan system. Here in the suburban quarter of Ouagadougou, the capital of Burkina Faso, here we have some urine collected in different families where they previously installed urine diverting toilets. So this guy is in charge of collecting the different tanks from households and bringing in this place to pour in the big tanks. And after that, the urine is stored there for 6 months. And after this 6 months, here in the big tanks, urine is collected there. And after the 6 months, the urine is considered as treated and free of the main charge, which reducing considerably the sanitary health risk. So Efficiency in pathogen reduction is proved, mainly by WHO, and who clearly mentioned that at 20 degrees Celsius, it's important to know that this is a storage temperature average for a different type of studies. And at Ouagadougou, the average temperature is higher than 20 degrees, meaning that this is really adapted to the temperature context of Burkina Faso. And storage time higher than 6 months give the best result, meaning probably non-possible pathogen in the urine mixture after storage. And then it can be used for all crops. You can see here that there are two codes of colors. The yellow tanks is raw urine, meaning untreated one, and the green colors is a treated urine. It's more simple for that for farmers who will pay this fertilizer to know that the green tanks is the treated one. Okay, concerning the others criteria, unfortunately, this system is not simple to implement by farmers themselves before using as fertilizer because treatment is managed by intermediate organizations. And it's an issue, why? Because usually this kind of organization is closely dependent to projects, meaning that when the project gives them some subsidies to continue the activity, yes, they can provide treated urine. But experience shows, especially in Burkina Faso, that when the project stopped, actually 2 or 3 months after, the organization also stopped his activity. Meaning that farmers who really take some habit to use this urine don't have no more provision of urine. So in case of sustainability of the system, strongly dependent to the ability of such organization to keep the activity and make it economically profitable, which is sometimes difficult for such kind of small organization. And also concerning this criteria, cheap or even free, farmers have to pay for treated urine. And for small-scale farmers in rural area, which still practice subsistence agriculture, meaning rainfed agriculture with no fertilization, it's difficult. Even if this kind of fertilizer is cheaper than conventional one, it's still difficult for them to pay it. That's why, due to these two limiting factors, we think about an alternative treatment for this kind of small-scale household farming in developing countries. So solar inactivation is this alternative treatment. And here, our intermediate organizations are replaced by farmers themselves for urine collection and treatment. And in addition to the economic benefits of this system, it also reduces urine contamination, since mixing different sources of urine is limited, because here actually the farmer just collects urine coming from his own household. So as he himself explained to you, he collected his own family urine when the tank is full and replaced it by the empty one. And after that, the tank is bring and the fill here in the intermediate container just to facilitate the conditioning of the small PET bottles. And after that, another person could help to put these bottles in the roof of the toilet or in even any other's roof, actually. And of course, for the different criteria already mentioned, no power dependent is necessary, of course. Inactivation is proceeded just by solar heating and UV light, okay? And concerning the implementation, it's very simple for farmers to do it themselves. And it's also cheap, actually, because they just need local material like PET bottles, a container, so it's not expensive. And farmers can use their own treated urine to fertilize both vegetables and cereals. So efficiency in urine pathogens, I will finish by this. We, of course, make some experiment at the lab to be sure that inactivation will be efficient in these bottles. And we found that it's possible to have six log reduction for E. coli. And here you have also one idea of which temperature can be reached inside the bottles. And after all this experiment, both at lab and on field, we set finally 7 days during dry season of exposition. And during rainy season, of course, insulation is lower, so we extended the exposition time to 14 days. Based on this exposition time, yes, we can reduce considerably the health risk by reaching a very good inactivation rate of the pathogens. And what also we can see is that comparing to the first treatment presented, the treatment time is considerably reduced from 6 months to maximum of 14 days during rainy seasons. So this is also interesting for the farmers because they can, if other factors are existing, meaning mainly water, they can use this urine during all the years. So I will conclude here by this word saying that I presented here two types of treatment of urine. Formerly, I presented the high fertilizer value of urine, provided that it's well used and the fertilization is optimized, of course. And also, what we should retain here is that we can differentiate two types of treatment. The first one is for big scales utilization, more suitable in the cities, in the urban area, and or solar inactivation treatment, more suitable in rural small-scale households. Okay, so thank you very much.
Thank you.